In 1994, a trauma team in Southern California initiated a routine, life-saving intervention. 45 minutes later, their patient had passed away, and the emergency room had become a mass casualty disaster zone. The patient's biology had inexplicably generated a toxic compound that incapacitated her own lifesavers. The patient was 31-year-old Gloria Ramirez. She arrived at Riverside General Hospital suffering from late-stage cervical cancer, an irregular heartbeat, and severe breathing difficulties. The medical staff immediately initiated standard protocols, pumping her with oxygen and preparing to shock her heart with a defibrillator. But as the nurses worked, they noticed a strange, oily sheen covering her skin. Then a distinct garlicky ammonia odor began wafting from her mouth. The anomalies escalated when a nurse drew blood from Ramirez's arm. Inside the syringe, floating directly in the blood plasma, the staff observed mysterious manila-colored crystals. Blood does not naturally crystallize. In seconds, a routine resuscitation had become lethal to everyone in the room. The nurse who drew the blood fainted on the spot. A medical resident grabbed the syringe to investigate, smelled the ammonia, and immediately collapsed, followed closely by the respiratory therapist. Within minutes, 23 separate hospital workers were afflicted. They experienced severe muscle spasms, extreme nausea, and shortness of breath. The situation grew so dire that the entire emergency room had to be evacuated to the hospital parking lot. Ramirez died from kidney failure during the chaos. To secure the area, a specialized hazardous materials team was dispatched to sweep the evacuated trauma room for chemical leaks. The hazmat sweep yielded a baffling contradiction. The team rigorously tested the air for volatile compounds, but they detected absolutely zero hazardous gases. An invisible airborne agent had just poisoned nearly 22 dozen trained medical professionals, sent 5 to the hospital, and forced an evacuation. Yet it vanished without leaving a single chemical trace in the room. To solve a medical mystery with missing evidence, investigators rely on a diagnosis of exclusion. They systematically test and eliminate every impossible or unlikely theory until only the truth remains. The first suspect was the environment. Theories circulated about a hospital sewer gas leak or even a covert methamphetamine lab hidden in the building. But thorough inspections by the State Health Department and OSHA found the ventilation and plumbing to be completely clean. With physical hazards ruled out, the Department of Health Services issued a highly controversial psychological diagnosis. They concluded the medical staff had simply suffered an outbreak of mass sociogenic illness, commonly known as mass hysteria. But the medical staff's own physical injuries quickly unraveled that theory. The medical resident who fainted spent 2 weeks in the intensive care unit fighting hepatitis and avascular necrosis, a condition where bone tissue literally dies from a lack of blood supply. You cannot hallucinate dying bone tissue, and panic doesn't explain crystals floating in a blood draw. The physical evidence forced investigators to abandon psychology entirely and seek a complex biochemical explanation. The Riverside coroner brought the evidence to the Lawrence Livermore National Laboratory. There, forensic scientists proposed a highly specific step-by-step chemical cascade. Investigators suspected Ramirez used the pain remedy DMSO, which accumulated in her bloodstream. Paramedics flooded her system with oxygen, oxidizing the DMSO into dimethylsulfone, matching the manila-colored crystals. Finally, defibrillator shocks converted those crystals into a highly toxic gas, dimethyl sulfate. Dimethyl sulfate is a highly toxic alkylating agent, originally used as a chemical warfare weapon. It vaporizes quickly and damages the lungs, muscles, and liver, perfectly mirroring the rapid, severe poisoning the medical staff experienced. Many organic chemists dispute this theory, arguing that the human body isn't a hot enough environment to trigger that specific molecular conversion. Yet decades later, it remains the only scientific hypothesis that accounts for the mysterious crystals, the distinct garlic ammonia odor, and the severe staff injuries. Because of contamination fears, Gloria Ramirez was isolated in a heavily sealed, airtight container. It took 10 weeks to release her remains, and by then, the body was heavily decomposed. Her heart was missing, and an independent autopsy yielded nothing. The Ramirez family never received the closure they were looking for. They rejected the complex laboratory hypothesis entirely, maintaining until the end that a hospital cover-up was responsible for her death. The Toxic Lady incident remains a frustrating anomaly. It stands as a stark reminder of the absolute limits of forensic science when attempting to reconstruct a fleeting, localized event. Sometimes the human body and standard medical interventions can combine under the exact wrong conditions to create lethal reactions that simply defy our ability to measure them.
If you like this video, give us a thumbs up